Good evening. I'm Andrea Anderson.
I'm Brian Allen. If you've ever noticed someone struggling with sobriety in our city's core or wondered about broader solutions for panhandlers, there is now a new solution.
In our top story here at 6, Beth Warden has more about an alternative to calling law enforcement when you see someone in need on the street. She joins us now with that story. Beth, good evening.
Good evening. South Dakota Urban Indian Health has already established physical, mental, and spiritual health services. They were the first ones in the area to distribute home COVID kits to anyone in the community during the pandemic. Now, the organization is bringing more solutions to downtown Sioux Falls. South Dakota Urban Indian Health is for anyone, regardless of descent. CEO Michaela Sieber sees more growth ahead as the organization moves beyond the clinics, classes, and gatherings with the Wa'oki'e Project.
It's the most important project I think that we're undertaking in this next year.
The project brings their care and concern to the streets.
Wa'oki'e means like helper or to assist, and that's what it means in Dakota.
1 month into their soft launch, they've helped those on the streets in many ways.
Them with appointments or giving them bottles of water, handing out Band-Aids, menstrual products, doing blood pressure checks, blood sugar checks, answering questions. Making sure mental health is addressed in a good way.
In the downtown area, there is an alternative to calling the police about someone's sobriety or safety.
A little too intoxicated or panhandling, a little too hard or getting into traffic that they might need some help. Call us directly instead of law enforcement, and then our team can go and respond. We've already made amazing relationships, and we know a lot of folks on their first name basis already. They recognize our shirts and our vehicles.
Sioux Falls law enforcement is an essential partner to the Wa'oki'e Project. Police helped through logistics and provided training in de-escalation and safety practices. Lieutenant Jason Leach is glad for their contribution, saying South Dakota Urban Indian Health is able to provide more wraparound services, including case management, to provide individuals in need with further resources and assistance. As the teams continue to build relationships, Sieber hopes for more safety and services for everyone downtown.
So rewarding to see the impact our organization is making in real time. It means so much to me that we're doing this.
And police say the program allows law enforcement efforts to go to other calls. The next step will be setting up a dedicated phone line for anyone to call if they see a need. Brian and Andrea?